I want to thank you all for coming tonight to hang out with us so we can give you guys the results of our final feedback session from the listening sessions we had. How many of you guys attended all 3 of the listening sessions? Okay. All right. Thank you for joining us tonight. So my name is Mika Christian. I am with American Heart and IU. So I was the lead on this program. So the purpose of this session is to share what we learned from those 3 listening sessions we had here, and to be able to give you guys that information so that you know that the sessions weren't in vain. So basically, we didn't take the information you guys provided to us and we just didn't do anything with it. So as you guys have seen on the slides, it was a few information that we had put together from what we received from you guys. Next, I'm going to do an overview of the Nutrition Hub. How many people are familiar with the Nutrition Hub? All right, so the Nutrition Hub is a partnership with IU, Purdue, Gleaners, and American Heart. So the Nutrition Hub was formed because one of the nurses within IU, there was some individuals that were getting ready to have surgery, and that they were going home, and they told the nurse that in their refrigerator all they had was milk and cheese. So if we want people to be healthy and prepare for surgeries and get ready to do what's needed to get our health in order and eat healthy, how can we send you home and say, hey, the surgery's coming up, be prepared with no nutritious food, correct? All right, so that's how the Nutrition Hub came about. So then they talked to all their friends, Purdue, IU, Gleaners, AHA, and formed this partnership so that we could have the Nutrition Hub. It is a program where neighbors that live in 46202, if you answer a few questions within our screener, you are in that zip code and you're experiencing food insecurity, then you can get on our program. We provide you with 6 months of free food from the lockers every week, up to 50 to 75 pounds of food free every week. And then we also do hypertension screenings, we do lunch and learns, lots of things to keep our neighbors engaged and the community. So, a few things we've done. We have 6 community-based organizations that we partnership with. So churches, the John Bonner Center, Women of Wellness, Goodwin Center, different organizations we partnered with. We did lunch and learns. We trained some of the staff so that they could do food insecurity screenings and learn how to do hypertension education, providing with the information. We did 15 training sessions. So what we did was we trained people within these community organizations so that what we do here, they can do at those sites. We also created 3 pantries within 6 of our community organizations. So what that means is that now we have more access for you all to be able to get those healthy foods that you need outside of going to maybe out of your area. So within 46202, we've created 3 new pantries. We screened 338 individuals for our food nutrition program. Out of those 338, we had 160 enrolled. That's almost half, but when you think about it, we can lead a horse to the water, but we can't make them what? Absolutely. So we gave them the tools and the information so that they could get on our program, and then it was up to them to be able to actively be on the program and participate. We also have in our Nutrition Hub that's down the hall, some of you guys passed it as you came in here, we have a blood pressure monitor to where we have it open and accessible for anyone that comes in this hospital, anyone that's on our program, anytime they want to come in to get their blood pressure checked. We also had a 6-member advisory board. And those individuals are people that work within the community already, that have trust in the community with people just like yourselves that helped us figure out how we can do our community listening sessions, how we can make our program more accessible, and for the neighbors that are on the program. So making sure that we were doing what they were hearing from those individuals within those community organizations. We also have a Nourish RX program where we have people that have medically tailored meals that are delivered to their home. Some of those individuals are have breast cancer. Some of them has Crohn's disease. So all of those individuals, I think we have 24 on our program that they get medically tailored meals to help them stay healthy with their chronic diseases that they have. And we had a data party with our community advisory board. So it was 10 individuals in the community. And what we did was we all got together and kind of figured out how are we going to lay out the program? How was we going to figure out how to get all of you guys in one place to be able to tell us the things that weren't working in your neighborhoods, that were working in the neighborhoods, and what you think you want to see happen in your neighborhoods to help you guys get access to those nutritious groceries. I am going to call up Calvin, and he was part of our 6-member community advisory board.
All right, good evening, everyone. I'm Calvin Roberson. By day, I serve as the Director of Operations for the Office of Community Outreach and Engagement with the IU Simon Comprehensive Cancer Center. But I've been a long-term community advocate here in Indianapolis. I've been a therapeutic foster parent for almost 15 years. I've been worked with agencies like the Indiana Minority Health Coalition, where we've done a lot of policy work, but also getting in the trenches. I've been with the 10-Point Coalition at one point in time, walking prayer walking neighborhoods, engaging people, sharing the message of hope. So I'm just glad to be here and just want to give you an overview of our community advisory groups. We had about 6 to 8 folks that participated that just provided input on recommendations that should be made about the project. You know, way the data is framed. Anyone's read data and wonder if it was talking English? So what we did is make recommendations of this is how you showcase the data. If you want people to know and understand what's going on in the community, this is how you frame it. But also here are some reliable sources within our community that you can go to. The Marion County Public Health Department has a whole lot of information that's just waiting to be galvanized. And so we share those sources with the American Heart and its partners. We also just provided feedback about how to frame questions, when to ask questions, and all those things, because you know, if someone comes to you when you are angry, are you more or less likely to respond in the way that is desired? And so same thing with community. If you don't come correctly, you can get shut down quickly. And so we wanted to make sure that the strongest foot goes first. And so we wanted to make sure that how the question is framed and who is asking the question becomes really, really important. The other thing that we did was help co-facilitate some of the community listening sessions. And so some of you saw me, I was at 2 of the 3, and what we just tried to do is make sure that people were engaged in the process. People felt comfortable in sharing. It was a nice atmosphere. We had a lot of laughing. I had my sister here in the yellow sweater. She had us rolling each and every time. She had sayings. I wish I could repeat them. But we had a whole lot of good feedback and interaction. People was feeding off of each other. And so it just created a nice, safe environment to tell the truth. And I'm going to tell you all the truth was told. And one of the primary truths was told is, you know what, at the end of the day, we are human beings. And so when we go to pantries and we go to food assistance, can you treat me like I'm a person? Not treat me like I'm a number, not treat me like I'm less than. That is something, it didn't matter what community listening session it was, that came out. Then there was also some generational challenges, because depending upon who spoke, some of our seniors said they wanted to go across the table and touch somebody because the youth were not engaging them in a manner that said, you know what, you respect me as a person. And what we had a conversation was, that's not how the modern day youth think. They're not thinking this in terms of that kind of respect. So, you know, back in my day, we didn't call each other bros. We didn't call each other this. They do that. So if you call someone a bro that was an adult, a senior, you got hands laid on you. That is not the culture. now. And so we just talked about the importance of bridging that culture with folks who are working the pantry, so everyone who comes through the doors feels welcome, feels safe, and feels like a person. The second thing that came out was, is there a way to systematically distribute resources that were available in a way that if you are at the back or the middle of the line, all the good stuff is not given away? Looking at the expiration dates, looking at the freshness of the foods. And also sometimes what we do know is sometimes pantries will get like gift cards. If you're not part of the first part, you just don't get them. And so we talked about, is there a way for them to do it where there's an opportunity for different folks to get those resources? The third thing we talked about was who was delivering the message about the resource itself. And so what was recommended is some of the smaller pantries, churches, at smaller community-based organizations may be better messengers. They're community leaders that should be engaged in the process, because a lot of people still don't know about the resources that are available to get food and to get other type of assistance. Because a lot of the food pantries, they're not just doing food anymore, right? They're hooking you up with healthcare. They're hooking you up with social services. They're hooking you up with transportation. Some of them are providing employment assistance programming. But if you don't know that's there, you don't go. And then we also talk about transportation. One of the things that was very unique about the hub here is they worked out a busing or transportation. You had people who were doing some follow-up to be able to engage community members to take advantage of the service. And so some of that was also captured during our talks. And one of the things that was really good to hear at the end was how the community members said, thank you for allowing me to share my voice. Thank you for taking time to listen to our care and our concerns and let us know it's not going to stay here, it's going to go somewhere. But at the end of the day, I'm glad that you listened. And I will say, we did have another nuance in our second session, where there was a cultural dynamic, especially with the Hispanic, Latino, and immigrant populations trying to engage in food assistance programs, and some of the barriers that they were facing just being able to speak the English, but also how they were treated during the process. And so we had a lot of good, valuable information, and we just want to thank you all for participating and giving us that feedback. I know even on my job, I take the information. I've had conversations about, I was talking to the folks at the national part of American Heart about we need to do emergency preparedness for hunger. The signs are on the wall that is coming down the pike. And so what are we going to do to build something that people can go to for food? So some of the information that we got here, I've begun to have different dialogues with people in other places and spaces in the state. So again, thank you, and I'm going to turn it back over to Mika.
Thank you so much, Calvin. So he was very instrumental in helping us with our listening sessions. One, because he understands the side. As he said, he's been in foster care for over 15 years. So that means he's dealt with a lot of individuals. He's been able to help people, and he's been able to have that inside voice of what the community really needs, because he's been very instrumental in helping the community. So thank you again, Calvin. Next, we have coming up Nicole Gonzalez. She is part of our national data team. And she was the person, a part of the team that helped us take everything from those 3 listening sessions we had and pile it together and say, hey, this is what we got from the community. She was very instrumental in helping us get all of those recordings into format for you guys all. So come on up, Nicole.
Hi, everyone. So I have I apologize, I have notes. I'm not as good off the cuff as Mika and Calvin are, so I'll try my best to not just read from my screen. But as Mika said, so my name is Nicole Gonzalez. I work at the American Heart Association on what's called the Data Science and Evaluation team, and I am an evaluator. And what that means is when the AHA does stuff, different programs or different initiatives, I work with the teams who are implementing it to try and figure out what's working well for the people the programs are meant to serve, and what are some areas where we can maybe do a little bit better. So I have had the wonderful privilege of working on this program with Mika and Alicia and Calvin and Kylie and Tim for a little over 2 years now. It's been really gratifying to get to do this community work, because we don't always get the chance to do this type of work where we're really in the community and getting to speak with people who our programs are meant to support. So I know everyone else has done it. I'm going to as well. I just want to really thank everyone for coming out tonight, for sharing your perspective. It is truly invaluable. And I know that time is a precious resource and commodity. So just really appreciate you all taking the time to be here for this event and all the other events that you've come to before this. So Calvin gave a great summary of the listening session. So some of this is going to be a little repetitive, but I'm just going to go over a little bit more about what we found. So as people have mentioned, we had 3 community listening sessions earlier this year that were focused in on the 46202 zip code in Indianapolis. As we said, they were led by Calvin and Mika, and the point of them was just to have really an open forum where we could ask some questions of things that we were interested in learning more about, but making it really open for people to provide whatever feedback they wanted to give us. And because of the program, we were really interested in looking at how people access food, how they access nutritious food, and what are the barriers that exist in the community, and also get some ideas on how we can better address any issues that have come up. After those listening sessions were held, so they were all recorded, I got those recordings and transcripts of them, and I and one of my teammates at the AHA went through them a bunch of times to try and find common themes across from them. It's a little tricky because we're all individuals and have our own preferences and the ways of wanting things to be, and so something that I say might not ring true to each person in the room, but we tried to just broad strokes look at what people were saying across the sessions to try and come up with some key takeaway messages, and that's what's up here and what I'll share with you today. We put things into 5 buckets while we were looking through the transcripts. The first one was looking at food access and affordability, or cost, and this was just, if you have to go to the grocery store, what is that like? What are the barriers that people are encountering? And the gist of it is that healthy food is hard to find in general, and if you do find it, it's expensive. And it's making people make tough choices. Everything is more expensive and getting more expensive day by day. And so we have to make decisions of, do I, buy healthy food, or do I pay my electric bill? And if it comes down to it, we have to sometimes make less healthy choices. Again, some of this is repetitive with what Calvin said, but everyone spoke about how transportation is an issue. If you don't have a car, it's challenging to get to the grocery store. Public transit is not reliable. And I know in Indianapolis we have rough winter, so having to wait for a bus when it's cold and snowy or whatever is not ideal. So that's a really big barrier. And that even if you get to the store, people told us that they might not carry fresh foods, they might not be your preferred foods, the stores themselves might be unwelcoming, and things are just too expensive. So we talked more about food assistance services. What we heard from the people who attended the listening sessions was that food assistance programs, so pantries and things like that, are a great lifeline sometimes, but they don't always meet our needs. We heard that pantry hours can be unpredictable, so some places are supposed to be open from 3 to 6, and you show up at 5:30 and either it's closed, or if they are open, they don't really have anything left. And obviously that's a problem. We heard from people that they want more choice. And this is something where there was a little bit of disagreement. Some people liked the idea of just getting a package, a prepackaged box of food, so that it is equitably distributed, and so that the good stuff isn't going to the people who are able to show up earliest. But I would say the more overwhelming feedback that we got was that everyone wants to be able to pick what they get. Certain foods might fit your diet, your cultural needs, your just preferences for what you prefer to have, and that having that flexibility to choose is valuable. The next bucket of stuff was trust and community. And so we heard that trust is really sort of everything. And that, again, Calvin touched on this a little bit, how you're treated matters just as much as what you receive. That programs that were welcoming and respectful and consistent were the way to build trust. And that when staff are kind and treat people with dignity, which again seems like a very baseline thing, but isn't always given. So if people are treated with dignity, it made a big difference. We also heard that we asked people how they heard about different programs, and we're told that like word of mouth and local leaders were really critical in that. And so churches and neighbors and community groups were the way to really find out about programs that existed. Next were the challenges that we faced. And so an individual program might have a challenge, but sometimes there are bigger issues at play. One thing that came up a fair amount of the listening sessions was just how housing costs and gentrification were pushing out affordable stores and long-term residents so that you can't afford to stay in the neighborhood that has been your home. Or if you are there, the resources that are moving in are not geared toward those longer-term residents. Some people talked about how the eligibility rules for programs can be unfair or just confusing. And one particular issue that people talked about was how if you don't have a stable address but need an address to sign up for a program, it sort of eliminates your ability to be able to participate in it. And so having just really complicated rules to be able to enroll in a program is a challenge. And again, as Calvin said, technology is a barrier. So some people, I have my notes here instead of on a piece of paper. So we always want to go to like QR codes and links, doing everything online, but that is a barrier for a lot of people. So it doesn't have to be one or the other. We should just try and meet all people where they are and provide both paper resources, physical resources, as well as online ones. Finally, we tried to talk a little bit about solutions. And so not just what's not going well, but what are some things that people want to see in the community. And so we talked about how community gardens, food hubs, like what was here at IU, and cooking classes were things that people said they would like. And that it wasn't just about providing food, but being able to like learn skills, learning how to cook, learning what things are healthy and how to prepare them was really helpful. And also just it's a way to help build relationships within the community. So having something that you could participate in versus just receiving the food was something that people said that they would like. A big takeaway was that people want programs that are led by the community, supported with real resources, and that are sustainable, which that sustainability piece is a constant challenge, but something that we want to work toward. So those are the like big takeaway messages that we had from the listening sessions. I'll just talk a little bit about how we're thinking about using that information. So like I said, we don't always have the opportunity to have things like this in the programs that we do. So it's really just like wonderful to be able to hear from people exactly what works for them. Like I might have my ideas of what works for a program like this, but I don't have the lived experience. So again, thank you for everyone who was willing to provide that. We're taking this information and just trying to use it for when we plan additional programs. And that will be relevant for Indianapolis, but the American Heart Association is a big organization and works in a lot of different places. So this information is really going to be helpful for planning programs across the U.S. basically, because, every place is unique. Maybe even if you go to a different part of Indianapolis, we might have gotten some different feedback if we asked the same questions. But there are some common threads across all places. So we're really hoping to be able to take this and advocate for programs and initiatives that really address people's needs. I think that's everything. So I'll pass it back to Mika. Thank you, everyone. Sorry.
Thank you, Nicole. All right, everyone. So I like to stay on task and make sure that I honor you guys' time. I do want to put out there, so everyone, the Nutrition Hub was a pilot program, and it ends in December. A lot of people already know that. So I want to say thank you to everyone that has been a part of our program, because without you guys, we could not have done this. So as we gear up to finish and phase down in December, continue to use us, call us if you need help, if you need resources. Alicia is available. I'm available. If you need information on other pantries or information on your voter registration, anything, help with anything, you guys know we are here. And then at the end of the year, it doesn't stop, because if you still need us, contact us. Our numbers are still the same, and we will be able to put you in contact with those individuals to help you guys.